This is the Medical Minutes Podcast on the All Indiana Podcast Network. Your source for the latest news, updates, information, and more from the world of health and medicine. Now, here's Wish TV's medical reporter, Dr. Mary Gillis.
From Wish TV, I'm medical reporter Dr. Mary Gillis, and this is Medical Minutes on the All Indiana Podcast Network. Some COVID long haulers are turning to a controversial method to treat their lasting symptoms. Blood washing. It's a technique where a person's blood is drawn, filtered for the purpose of removing toxins, and then injected back into his or her body. Theoretically, scientists say it makes sense. Blood washing may have the potential to remove dangerous circulating microclots and other damaging cells that could be contributing to long-haul symptoms. But what does the evidence say? I turn to Dr. Sachin Mehta, Medical Director of Neuro Rehabilitation at Franciscan Health, for some answers. Our conversation is next.
So Dr. Mehta, we're talking about this blood washing for long COVID patients. So first, what is blood washing, and why would it be something that would benefit, if it does benefit, long COVID patients?
Well, so blood washing is where they actually draw your blood, go through a filtration process, and then inject it back into your own self. Theoretically, I think what the thought is that that there might be certain microclots and different types of immune cells that can maybe get filtered out that could be contributing to long hauler syndrome. We actually do not recommend this treatment. And actually, we have not had any Hoosiers ask for this treatment in our practice. And we've had over 1,300 patients with long haulers in our program. But but I can theoretically, if people are struggling with long COVID, it is an epidemic. It's causing significant dysfunction and impairments in their ability to work and do their daily activities. So people are always kind of looking for a quick fix and something that may help them quickly. So I can understand why some people may be looking at these kind of things, but it's not really proven to be beneficial. We know that these microclots exist, but we don't know if the microclots are causing the long COVID or just happen to be some type of signal that there is long COVID. And so just removing these microclots may not actually improve our symptoms. We just don't know enough about it. It's expensive. Insurance doesn't cover it. Anytime you poke your skin with a needle, there's a risk of infection. It's very costly. So there's several reasons that we don't recommend that at this time.
Right. I wanted to ask you, what does the evidence say about this? And has this been used in other sort of treatments beforehand? Is this something new, or have we done blood washing for other ailments, other illnesses?
That's a great question. Blood washing is used for other conditions. We know that there is some significant benefit for certain types of cancers and other blood disorders. So it's not a new treatment. It's been used for other conditions and has been shown to be effective in those conditions. But there is no evidence currently that blood washing improves long COVID symptoms. We've heard about some different centers internationally, even some not in Indiana, but other places around the United States that may be marketing these type of services. But again, there just isn't enough evidence to show that paying that amount of money is going to improve our function in the long term or even in the short term.
And can you talk about the process? You said the microclots, and you also said immune cells that we want to sort of extract those from the blood and then filtrate it back in. So could you say specifically what the theory is, let's say?
So what makes this difficult is we don't exactly know what causes long COVID, and that's why we don't really have great treatment options. Well, we have good treatment options. We have comprehensive rehabilitation programs such as the Franciscan program that has really good outcomes, but it does take it's a very active approach and a lot of rehabilitation and exercise. But people do have significant improvement in function, but we don't know exactly what causes it. There's different theories, whether it's remaining particles of virus that are, after the virus was killed, there's some remaining particles of the virus. Did the virus activate some type of immune response or our body attacks ourselves and our own organs? And so there's a couple of different theories, but we don't know the exact theory about why people get long COVID. And if we don't know exactly what causes it, we can't really implement some of these quote unquote experimental treatments to help those symptoms.
Right. Well, I was just going to say it seems more experimental right now. And then what would you say to doctors and patients about this? I mean, in theory, it seems to work, but we don't know in terms of any solid evidence. So doctors and patients, what's your message?
I would say my message to patients are we know there are some things that we do know work very well, and that's an active rehabilitation program with a combination of physical therapy, occupational therapy, and cognitive therapy to help with fatigue, shortness of breath, brain fog. We don't know enough about the bloodletting in the blood filtration system to know if it's actually going to remove the things that are causing the symptoms that we're having. So I would say if you are a long hauler suffering from long COVID symptoms, is go see your doctor, get the treatment you can, and if needed, get referred to a comprehensive rehabilitation center that can help improve the symptoms you're having. And we're getting great results with this current program right now. And most of our patients don't need to explore those kind of experimental options because they're getting better with our currently available options we have to treat this.
Okay, well, that's good news. And anything else I missed that you'd like to add?
No. One most important thing is that if you have long haulers symptoms, get help, see your doctor, and if needed, get referred to localized comprehensive long COVID rehab centers so we can get you the treatment that already exists that's been shown to be very effective. But there is help out there, and there's a lot of hope for people who are struggling with these symptoms to get help and get better and be able to do the things they want to be able to do again.
Okay, well, great message. There's help out there, so let's hope for these folks that they get the help they need. Well, thank you so much. It was great seeing you again.
Thanks, Dr. Gillis. Good to see you again.
This has been Medical Minutes from Wish TV. I'm medical reporter Dr. Mary Gillis. Be sure to follow and subscribe to this podcast and check out new updates every week. You can also learn more at wishtv.com and when you follow Wish TV on Facebook.
This is the Medical Minutes Podcast with Wish TV's Dr. Mary Gillis. Be informed and stay connected for the latest news and information when you like, subscribe, and follow this podcast and discover even more from the All Indiana Podcast Network. Now at allindianapodcast.com.